I'm Mary McGowan. I'm the Chief Medical Officer of the Family Heart Foundation. I've been in clinical practice in lipid metabolism for about 30 years. Presently, my clinical practice is at Dartmouth Hitchcock Medical Center, which is part of the Dartmouth Medical School. And the Family Heart Foundation is a research and advocacy organization that I've been involved with since its inception in 2011. In fact, I was the very first chief medical officer, did that for a year, and then came back about 3 years ago. The Family Heart Foundation is dedicated to individuals who have elevated lipoprotein (a) and a disorder called familial hypercholesterolemia, which comes in two forms: heterozygous familial hypercholesterolemia and homozygous familial hypercholesterolemia. So we're dedicated to doing research and advocacy and changing the status quo for individuals with these disorders. So homozygous familial hypercholesterolemia, or HoFH, is a genetic disorder whereby a person has inherited two genes for familial hypercholesterolemia. So rather than inheriting a single gene from a parent, each of the person with HoFH has inherited a gene from each parent, and that doubles the impact. And so it is not unusual to see somebody with HoFH as a child who will have LDL, or bad cholesterol, greater than 400, and even as high as we saw in our study, greater than 1,000. And so for some perspective, a child should have an LDL, or bad cholesterol, less than 110. And so having an LDL of 400 puts that child at risk. And we often think about cholesterol years. So each year that a child has an LDL 4 to 10 times higher, that their arteries are aging 4 to 10 times the rate of a child that doesn't have familial hypercholesterolemia, homozygous FH. As a result, we see children with homozygous familial hypercholesterolemia who can have heart attacks as early as the age of 2. In our study, we had children having early heart attacks. We had kids having bypass surgery at the age of 6. So it's really a very devastating disorder, but not for everybody. For some people, they're not picked up until they're adults when they have a cardiovascular event. So it can be variable because of the variation in the degree of LDL elevation.